Good day everyone. Today we'll be discussing about cardiac arrest. What do we mean by cardiac arrest? Cardiac arrest is the sudden cessation of what we refer to as CMA, the sudden cessation of cardiac mechanical activities, which results from the absence of circulation. This cardiac mechanical activities, it results, it comes about when there is an absence of circulation. So now, when we say cardiac arrest, this means when the heart stops due to a certain reason, which the reason could be the heart producing an irregular heart rhythm, which is known to be arrhythmias. Once the heart is producing irregular heart rhythm or a disorganized sound, that is when we come about cardiac arrest. Now moving on to types of cardiac arrest. We have two types of cardiac arrest rhythm. One, we have the shockable rhythm. We have the shockable rhythm and we have the non-shockable rhythm. We have the shockable rhythm and we have the non-shockable rhythm. The shockable rhythm, it responds to defibrillation, that is electric shock. This responds to electric shock through the use of a device called AED, automated external defibrillator. We use this AED to defibrillate, to provide shock to the heart by using this device. So once the shock is provided to the heart responds. Now the second non-shockable rhythm. This does not respond to defibrillator. It is only going to respond when high quality CPR. The non-shockable rhythm, it responds to when we provide high quality CPR, not just providing CPR, but a CPR at an high quality, that is the cardiopulmonary resuscitation, and also by addressing the reversible causes. Now, we are moving on to the causes of cardiac arrest. That is, what are those conditions that causes cardiac arrest? One, we have myocardial infarction. Myocardial infarction is one of the conditions that causes cardiac arrest. Two, we have electrolyte imbalance, e.g., hyperkalemia, and so on. Then, three, we have coronary artery disease. So these are some of the conditions that causes cardiac arrest. Now, moving on to signs of cardiac arrest, that is what you see in patients to say or to arrive at cardiac arrest. One, there is no pulse. There is no pulse presence, that is the heart stops beating. Two, we have no normal breathing. Or there is only grasping. It is either there is no breathing, no normal breathing, or just grasping. Three, we have sudden loss of unresponsiveness. So the patient does not respond to any activity. Then lastly, the heart stops. So these are the signs we see before we arrive at cardiac arrest. Now, the last aspect of it, the reversible causes of cardiac arrest. That is, there are some underlying conditions that when you see them, it can really lead to cardiac arrest. But if there's an urgent attention, if urgent treatment is being administered, there are tendencies that the patient does not come up with cardiac arrest. So those reversible causes, they are abbreviated to 6 H's and 5 T's. They are abbreviated to 6 H's and 5 T's. So the first of it, we have hypovolemia. The second, we have hypoxia. The third of it, we have hydrogen ion, that is acidosis. Fourth, we have hypo or hyperkalemia. 5, we have hypoglycemia. Then last of the H's, we have hypothermia. These are the reversible causes of cardiac arrest. I'm moving to the 5 T's. That is the 5 underlying conditions to prevent cardiac arrest. One, we have tension pneumothorax. Second, we have toxins. Third, we have tamponades. Then, the fourth, we have thrombosis. As far as this thrombosis is concerned, it could be related to pulmonary, which could be pulmonary embolism, pulmonary embolism, and the last, thrombosis. This thrombosis is related to the heart, which is coronary, which could be myocardial infarction. And the reversible causes of cardiac arrest, the 6 stages and the 5 T's. So thank you for watching. I will see you in the next video.